to get started? I'm still waiting on anything, Amy.
I think we're good. I have a few people trickling in, but I think you can go ahead and get started. Thanks, Becca.
Okay. Well, my name's Becca Lyons. I'm the intake investigative agent here with Butler County. It's really good to have these trainings. It's good to see all the people who took time out of your day to come, and I appreciate that. Hopefully we'll make this short, sweet, to the point, and get you going on your way. If you have any questions along the way, do drop those in the chat box. Amy will be monitoring that for me. But we'll start out today with some housekeeping. I'll give you some rule requirements for UIs. We are talking about UI, logs, and analysis today. I'll show some examples, some common mistakes that I'm seeing, give you some tips on analysis, and again, we'll answer any questions that you may have. So housekeeping, we do have a training certificate today. So if you wait through the training at the end, Amy will be able to get you a survey. Please answer that so we know how we can improve this training. This is our initial one in our series, so we're hoping to make these very useful for you and not waste your time. So do let us know how we can make this better. If there's any topics you want us to cover, let me know. But she'll get that training certificate to you at the end. So we will go ahead and get started. I think we'll have trickled in. So to start, we go with the dry part, the rule. So we're here to talk about UI logs. So I brought up the UI, the unusual incident rule. Incident being an event or an occurrence involving an individual. Unusual being out of the ordinary. It's not consistent with that person's care, with their service plan, maybe your routine operations. We're not quite to the MUI level when we're talking about UIs, but it's still, they generally follow the same pattern for how you report and what you need to do. Some examples in the rule are injuries, falls, ER or urgent care visits, overnight relocation. Several categories do look like MUIs, but we're not quite to that level of an MUI yet. So peer-to-peer incidents, maybe peer 1 struck peer 2, they caused a bruise on the arm. We don't have those requirements for MUI like a facial injury. We don't have significant medical treatment needed. We don't have law enforcement involved. Those are going to be at the UI level. So you're going to need to do a report, one for each peer involved, and those will go on your UI logs. Medication errors, same deal. If they miss an allergy pill or something that doesn't have that significant adverse outcome, then you're going to be at the UI level and you want to address it just the same as you would an MUI, but we're still at the UI level. Rights code violations, same issue. Unapproved behavior supports, this one is a little tricky. It's a little gray for us on the MUI end because the nuance of that rule is that we file some that I don't think have likely risk to health and welfare, but it's part of our requirement to file. So my advisement for unapproved behavioral supports is to go ahead, write those up, send them in. We'll take a look, we'll cover your bases. You can put on your UI log and report that you reported those, and we'll call that a day. And then lastly, the program implementation errors. This is a relatively new category for UI. Typically, we would have a neglect or nothing, but they kind of added this to show maybe the plan wasn't followed appropriately. I had one just this week, actually. Supervision level was required at 24/7 care. The staff person had to leave for whatever reason, so they left their shift early. It just happened by chance the guardian was coming in to do an unannounced pop-in visit. So they kind of crossed paths and the guardian sat with the person until the next staff could arrive. We still have a program implementation error. That staff should not have left their shift early. Fortunately, there's no risk to the person. So we don't have neglect by sheer fortune. But that's something you still want to track, you want to address with staff. They shouldn't be leaving their staff without communicating that. And you need to follow up with that person. Okay, I did include the form for an incident report. This meets all of the rule requirements. It is a template here provided by DODD. It's in their toolkit. Hopefully, I'm sure all of you have an incident report, either you're using this one or something that meets rule requirements. I just wanted to bring this up because I know we have providers mentioning that a lot of they're getting a lot of citations, especially on the notification section. It's kind of hard to see this, at least on my screen, but down there at the bottom, you do want to make sure you're notifying the guardian, the SSA, If it's a UI, it is required to notify other providers of service. So I did want to point that out to your attention. And we'll get to why here in a little bit when we go through some examples. But so this is your incident report form. We're kind of looking at a ground level view for what's going on with this person at this time in this state. And a lot of times we're going to have a lot more detail on this form than we would on the UI log, but we'll get to that also in a second. But for the most part, you're going to be able to copy paste from the incident report to the log because a lot of the categories are the same. The back page, same thing. We want to look at cause and contributing factors. Why did this happen and how can we prevent it? So going to the rule requirements for the UI logs, every agency provider and independent provider needs to review these at least monthly. So we need one for each month of the calendar year. You need to be doing that whether we ask for them or not. That's in the rule. And part of that is to ensure that the preventive measures have been taken. So a lot of times I'll get an incident report and it will say part of the prevention plan is staff will be retrained or the individual will follow up with their primary care physician. So when you get to that, when you're reviewing these, you want to go back and make sure those things happened, put those in the past tense and say, yes, staff was retrained on this date on this topic, or the individual did follow up with Dr. So-and-so on this date. So let's see, you also want to make sure trends and patterns are identified and addressed. So when we're looking at UI logs, we're kind of making a one sheet. So your incident reports, you have 10 of them, we'll say for February. You want to put all of those 10 onto one sheet form. It's kind of an at a glance to show us what happened. You're taking kind of a bird's eye view to see what's happening across your agency or across this home. And you're kind of looking for things that are recurring. So the trends and patterns, we'll get to what that means here in a second too. Any documentation that you have needs to be made available to us or to the state upon request. And we do request that annually. We'll ask for a couple months. And I will say part of the reason I came up with this training is because we're asking for things from a few months back. And I'm noticing a lot of holes and gaps. I'm going back to ask questions. And it's not hitting the purpose of why we're doing these reviews every month for you to go back and fill in the gaps later on. It doesn't make sense for the person. It feels like it's wasting your time. So I thought it'd be good to have to come together, see our expectations and maybe do things right from this point, and you understand what we're asking for and what we need. And again, I'm sending out some of the same notes over and over and over again. So that's kind of been established as a pattern in Butler County, at least. Okay, more rule requirements. You need to have a log. It's spelled out exactly what needs to be on the log. It includes the name of the individual, a brief description of the UI, any injuries, the time, date, location, the cause and contributing factors, and preventive measures. Again, a lot of this will be copy paste from your incident report. Sometimes you can even shorten it a little bit, but again, we're looking at two different forms here. And then when you do identify a trend or pattern, you do need to notify the SSA because it does need to be included in the individual service plan. So that's important to note. So what is a trend or a pattern? This is something that is not specified in the rule. DODD has given advisement that a trend can be considered 3 of the same or similar incidents in a given time frame. We had an old rule, it was prior to 2009, I think. Some of you may remember this, where we had a series of UIs would constitute an MUI. And that was considered 3 in a week or 5 in a month. And I know sometimes that language, that idea keeps sticking. We want to broaden that a little bit. There we go. We do want to broaden that because we have instances like we have an individual every Halloween dresses up as a vampire and goes and bites his peers. So, after 2 or 3 years, we realize this is a trend and a pattern. It's not 3 in a week, it's not 5 in a month, but it does meet that consistency that we're looking for to address. Again, DODs also advise anything that the team identifies as a pattern or trend for that person is a trend or pattern. Okay, why are UI logs important? They are part of our quality enhancement system. We are all here to make the quality of the life better for our individuals that we serve, better for staff, better for you as a provider, easier. We want to streamline our process. We understand there's a lot of redundancy in the UI system, in the MUI system. So whenever we can shortcut or take, make copy paste efforts, we want to help you do that too. But the bottom line is to make things better for the individuals that we serve. When you're reviewing logs, you might identify MUIs that were not reported. When you do identify those, please give me a call, let me know, we'll get the report, we'll get it handled. It's not the end of the world, we are human. I'm human too, I make mistakes. So part of the process of getting better is identifying when we've made a mistake, letting everybody know, be transparent about it, and we will move forward. Also, you want to identify trends and patterns and address those. And also, this is compliance. It's a rule requirement to do this every month. So that's why we're here. We don't want anyone to get citations on something that's fairly simple. This is a sample log. Before I go on, does anybody have any questions? Pretty simple so far, straightforward. All right, this is a sample log. It's in the toolkit on DODD's website. It kind of stinks because it is fillable, but it doesn't expand the box. So while it is good because it has all of the required elements, you might want to make your own. Hopefully you have your own. I'm bringing this up just to, you can compare, make sure that you are meeting the rule requirements. So at the top, we need the provider facility. If you're an independent, that's going to be your name. If you are an umbrella, if you have day programs and ICFs and waiver homes, then you can do that by day program. You can do that by ICF, by waiver homes. If you have like 5 or 6 waiver homes, we do want to see all of those on a one sheet, just so you can compare your data and analyze it appropriately. But you can kind of separate it by function, or it's not facility, but it's function. Month or year, that's June 2023, if you're doing it for this month. County is Butler. So when we ask for logs, we only need to see Butler County. We don't need Hamilton or Warren. We don't serve those people. We don't really need to know what's going on over there. So make sure that you are sending us only Butler County. To the left-hand side, the name is the name of the individual. Again, this is per type of facility. So if you have all of your waiver homes, you're going to have a lot of different names here. Let's say you serve 40 people. You could have up to 40 names here, however many you serve. We're not looking for one sheet per person. I know a lot of times the documentation does need to be separated. This is not one of those times. So we want every person that you serve kind of chronologically what's going on in this month in June. The UI number, that's really up to you to create your own system. It's really, I think, primarily for larger agencies where you might need to go back and reference one or track it. If you're a smaller agency, 1, 2, 3 is fine, even larger is fine as well. But date and time. Injury is not a yes, no. So we need to know basically the gist of what happened. I know some of you have nursing agencies, so you will have a paragraph of an injury of what happened. We don't need a paragraph. We just need scratch to right cheek, dime-sized bruise to the left forearm. That's going to suffice there. Again, this is a standalone sheet. It's a one sheet, so you want to be able to kind of see at a glance what happened. The home name and address, if you only serve one person, you only have one home, it's fine to put that at the top and arrow down. Sorry, I use my hands a lot. I noticed that just now. I'll try to hold that in. So it's fine to put one home address and arrow down. If you serve multiple addresses, you do want to separate that out. Location would be where the incident happened. May it be the kitchen or the bedroom, Meijer, McDonald's, wherever, sidewalk outside the house, the van, where the incident occurred. If you do have several places where people go, several McDonald's, and it's becoming an issue, you might want to note the McDonald's on High Street or the McDonald's over here. But as is, that's pretty self-explanatory. Description, you're going to kind of copy paste from your incident report. One exception I would say here is that your incident report might have a lot of antecedents. It might describe the whole morning leading up to this incident where Johnny punched a hole in the wall. We don't necessarily need all that for this one sheet at a glance. We can just say Johnny became upset and punched a hole in the wall. That should suffice for that. Immediate actions taken, we're looking for medical actions. Maybe the peers were separated. This is pretty common sense. This is straight from your incident report, which is required over there too. Your cause and contributing factors. I want you to always remember this means why. Why did this happen? And we're going to ask why until we get to the root cause. So an example that I have here is that we have Jimmy broke his leg. So we want to know what happened. Why did Jimmy break his leg? Well, Jimmy fell. Okay. A lot of times I'll see this incident UI log and it just says fall. That doesn't really tell me, we're not getting to the bottom of what happened. So why did Jimmy fall? Well, it turns out Jimmy had a seizure, and we know Jimmy has seizures. He's got a disorder. He takes medications. And for some people, that might be it. We don't know why. That might be the final cause, seizure activity, seizure disorder. But for Jimmy, we know maybe there's a trigger. Maybe he has light sensitivity. Maybe it's something he ate. Maybe he's sick. A lot of reasons could go into that. So we ask, why did Jimmy have this seizure? And staff say, he hasn't been taking his medicine regularly. He's been refusing. So we have a med refusal. And then we ask Jimmy, why are you refusing your meds? And it turns out that the pills are too big. They changed something in the packaging and they're just too big for him to swallow. Well, that's a whole lot easier to solve, to connect to a prevention plan than if we just said seizure or fall, right? We're getting more specific. We're asking why until we hit a wall and there's no more answers. So in that case, we would call the doctor, call the pharmacy, see if we can switch up those medications. And that's an excellent prevention plan for this particular incident. Moving on, you want to make sure at the bottom you do have reviewed by. We need a name, a title, and a date of review. And again, we're just looking to make sure these are reviewed every single month. Trends and patterns identified, addressed, and actions taken. We'll go on. Some clues of a very good UI system is that they do contain the required elements. So no matter what form you use, if you're using an Excel spreadsheet or Britco or some other template or format, make sure that they do have all of these categories in your log. They do need to be submitted timely. Again, we request them annually. We'll ask for a couple months sample just to make sure they're being done and being done correctly. And you want to, as you're looking at them, make sure there's no holes in there, there's no gaps, everything's completed thoroughly. I'm also looking for good immediate actions also on your incident reports when those come in. Want to make sure the person is safe, that they're getting the medical treatment they need. Police is called if they need to be called. Staff is separated or individuals are separated if there's an altercation, that there's protection in place. Again, I'm looking for no blank sections. I see this all the time. No blanks. Everything needs to be filled out. I'm also looking to clarify unknown or on the prevention plan, continue to monitor. That's kind of vague language. It tells me that you don't know, but if I see it a lot, it tells me that you're not really asking questions and not really digging deep. And there will be things you don't know. There will be injuries that happen that we don't have a time machine. We don't have, the ability to know what happened when no one else was there. But if that's happening a lot, I think it's fair to ask a lot of questions to start a creative process of what could be going on. If they're getting cut in the same spot, I think it's fair to ask to check their nails. If it's a scratch, check staff's nails if they need, basic hygiene care. Or, is it inadvertent? We're not saying that it's necessarily abuse or neglect, but what is happening to cause this? We're checking their environment, check their bed rails, maybe there's something loose on there, their adaptive equipment, their wheelchair, is everything in good working order? And if you find something that's a little off, you can say, possibly it could be this, we're going to fix it. We're going to see if that works. And then you just track over time to see if you got any results or if it continues to happen. And you just trying different things to try to prevent this.
Hey, Becca, we have a really good question.
Yes.
So someone asked if sickness like COVID is considered a UI.
So a sickness, if they have symptoms, if they needed to go to the ER, yeah, I would put that as is. I'll leave that up to your policies. I know everyone is doing things a little different. We're kind of out of the woods for that. Back in the day, I think they probably would have asked for more documentation. Anymore, if they don't need an ER visit, I would treat it as if it was a cold or the flu, and those are not necessarily things that would need an incident report. Okay, of course, if they're hospitalized, that's going to bump it up to an MUI if there's a provider involved. So again, we want prevention plans that are specific, and we want to address the cause and contributing factors and look at our patterns. Some common mistakes that I see all the time. Again, I'm fairly recently assigned to look at these UI logs. So I'm still new and learning with you guys, but a lot of times I'll look at a report and it won't be able to tell immediately if it was reported as an MUI or if it was ruled out. I just can't tell. There's not enough there, or missing some details that might be critical for you to ask to know if it meets criteria for MUI. So make sure that's kind of clear and spelled out. Anytime that you do send something over for review and we rule it out, it's good to put that on your UI log too, and on your incident report. That helps when the state comes down to do your analysis and things like that, your reviews. They'll be able to see that clearly. They won't have to ask you for follow-up. I see a lot of blanks, incomplete sections. I'm going to send those back, and it's really frustrating because I'm not looking at these until several months after the fact. So then you have to go and figure out what's going on back in February, and it's just a time waste for all of us, I think. I see no evidence of an analysis, so there's no signature, no date of who was doing that. Or sometimes I see trends and patterns, things that are recurring in there that just weren't addressed. And lastly, not showing a clear picture. This should be, again, a standalone document. We can see clearly what all was done. You're kind of showing your work. If it's not documented, you didn't do it. So we want to see all of those steps taken and in a pretty clear fashion. Okay, I have a little test. So you receive an incident report for Sam Wise. We'll say you're the one responsible for putting the UI logs together. He fell at the bowling alley and he was taken to the ER. So we're going to take a look at the UI log entry on the next slide. We'll see if it needs any help. I hope you guys can see that. It's kind of small. We have Sam Wise. We have the UI number. It looks like it happened at the bowling alley. Sam fell and cut his chin. He received stitches at the ER, and the cause was due to a fall. And the prevention plan continued to monitor. Is there anything we can do to make this better? Any thoughts?
Yeah, how we can not let this happen again.
Right, so our prevention plan continue to monitor is not very specific.
So maybe assist him with, getting into the bowling alley.
Maybe. I think we need to go back and ask why he fell. It could be a whole lot of reasons. So my first thing, I see a blank. So I'm going to ask about the blanks, the home name and address. I'm going to ask about the time, just because that's a rule requirement. You need to have that for your UI log. But then we're not very specific. Sam fell. It could be a medical emergency. It could be an environmental factor. He could have tripped. Just a one-time accident. So we want to know why, what happened, so we can figure out why it happened and then be able to address it. Also, from my MUI mind, I'm looking at stitches and I'm wondering how many stitches he got, because 5 or more, that needs to be reported as an MUI. So fall, again, I would ask more why until you get to the end. Why did he fall? And I agree with you, the prevention plan needs to be a little tighter. It needs to be connected. So I think we addressed, blank spots. I'm also looking at neglect possibly. Does he have a history of falling? Is there anything written in his plan that addresses where staff needs to be walking with him or needs to be assisting in any way? And maybe they weren't. There's not enough information there to show me that neglect was ruled out. But it's pretty vague, so there's not enough to show me the specific of what happened. And again, what can we do to prevent that from recurring? So a better entry here. Oh my goodness, it's so small. And that's why I don't like this template from DODD, but So we added in our details that are missing. We said Sam tripped over a chair and cut his chin. He received 4 stitches, so we know that's not an MUI. It was a one-time accident, and I think that's really small, but I think staff are going to try to recognize when he's excited and give him reminders to slow down, calm down, it's okay. So that's a better entry. It's a little more specific. We have our details. We know there's nothing missing as far as MUI wise. You guys see the difference. So some analysis tips. So when you're looking at these these UI logs, whether you are the one entering them or you're the one that's involved in the analysis, you want to take a look overall. Does anything stand out to you? So Butler County, we have around 4,000 people. I don't know every single person. Some of you have smaller agencies. I know you know your people very well, in and out. You know what's right for that person, what's wrong. And even before you get to this point, you're going to recognize something is off with this person and they need some help. But, you know, if you notice anything that stands out, I want you to just put a little note in your brain to follow up on that piece. You want to take your UI log, your standalone document here, look by person, see if there's anything recurring for those people and kind of note it. Sometimes there will be something that's related and sometimes not. If it's related, you can kind of add that to your trend and pattern and see how you can address it. If not, you could either note there were 2 for Bob, but they were unrelated. There's nothing to address today. The more you put in your analysis, the better it is, just to show that you are looking at it. Next, I would review it by house or by staff involved. If you only have 1 house, maybe you have 6 staff. And you know, you can add to this. You can add staff, you can add all kinds of categories if you are so inclined. I would definitely review by house. If you have several residences, you want to see what's going on maybe with the staff over at this house. Do you have similar issues going on, some training things that need to be touched on? What is happening? Kind of bird's eye view again over time. You want to review by category. So if you see a lot of med errors, you do want to check on those, make sure that you're doing what you need to do to make sure people are getting what they need. So again, are there any patterns? Are there any repeats in your log for this month? I would also compare it with last month. Have we gotten better with what we tried to do last month? Is it still going on? What can we do different? We want to try to, our people are not in a bubble, so we can't protect them from everything, but we want to do the steps that we can to keep them safe. So with these repeat occurrences, why do we think that's happening and how can we address it? And things to consider would be medical or behavioral issues, staff training. Maybe you have a rogue staff doing whatever they want, not following the plan. And I think we've had a few of those here recent. They know that they're supposed to put a helmet on the person because they have seizure disorder and they fall, and they're just refusing to do that. So you might have to take some disciplinary action. There could be some compatibility issues either with staff or the person just doesn't mesh well with the staff. They want someone else. You might consider those options. Environmental changes, if they keep falling over something in their living room, maybe you change up the furniture, stuff like that. That could cause some change for the person. And lastly, does the ISP meet the needs? So this would be something like a program implementation error where, you know, the ISP is not being followed regularly or consistently, but it turns out the person really doesn't need those supports. Maybe you're very short-staffed and you can't get staff to this house regularly. Maybe the team can consider some other options while we're getting through this crisis. Maybe there's some remote supports that could be put in place. So all of those things are things to consider with the team and see what we can do better. Again, document all of your efforts, track your progress and your successes month to month. So if you've really been working and focusing on med errors, you've done a lot of retraining. So you're going to look at May's data, and there's a lot of med errors. We'll go to June after you've done the training and everything, see if it's decreased. And if it has, put that in your analysis. You know what? We've taken steps to train and we've noticed a decrease in this. Yay us, yay for the people that we serve, yay for our staff. Celebrate those successes. And there's some further questions. So when you're putting an action step in place, this is either for the prevention plan or the addressing the trends and patterns. Does this action step address the cause? Is that within the control of the responsible person? Are you asking staff to take someone to the doctor when their family is responsible to do that? You're kind of overstepping boundaries there. So you want to make sure that you're working within the boundaries of what you have. Are the necessary resources available? You want to ask, does this actually minimize recurrence of the incident? How will this make a difference? And how will I make sure that this was implemented? Again, when you're going through your logs, you want to go and make those prevention plans past tense. You want to check, did they go to the doctor? Was staff retrained? Did we move this piece of furniture? Did we buy them new shoes? Whatever you had in mind to prevent that, did it happen? You want to make sure that that's implemented.
Becca, we had another question.
Yes, please.
So what about when going to a routine doctor appointment, the doctor determines the individual needs more advanced care, such as toenail removed or wisdom tooth removed?
For those, I would document that at least as a UI. It's out of the ordinary for that person. If it's something where they go in to have something removed and then there's an adverse outcome that was unexpected, they went under and something happened with their heart, we're going to look at that for MUI reasons. But for those kind of things, I would still document. It's not in their normal routine operations. Right. Okay, well, moving along, if there's no other questions. So I gave you a copy here.
Sorry, one more.
Yes.
It just popped in. Great question. So question, what, you got a client who balance is not stable and fall every time they crawl to the bathroom.
So if you have something that's become usual for that person, falls are a little different because we do want to track those. If they are falling all the time with no injury, I would say that's probably the line. I would talk to your team first and the doctor, see what they recommend. You definitely want to document falls. That could be a separate log where you're documenting when they fell, if there's no injury. If they fall and scrape their knee, you want to do an incident report just because that's an injury. It's a requirement in the rule. And falls, again, they're so tricky because especially if you have an elderly population, it can lead to so many problems, and falls are a little different. I think that actually might be one of the requirements. I have to go back.
And then someone mentioned they can't hear. I'm not sure if it's just that person. I just want to make sure everyone else
Can you guys hear me?
Okay.
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 I don't know what to do there. I'm just double checking here. I don't want to give you the wrong information. And I will pull that up at the end. So moving forward for UI report logs. This is an example of one to send in if you didn't have any UIs, and that's typical for especially independent providers or smaller agencies. There could be months where you just don't have anything reportable. Butler County, we used to accept an email saying there were no UIs for this month. DODD has clarified that we're not just checking that there were no UIs, we're checking the system. So maybe there were none in February, but we want to make sure that if there are any in March, April, May, you know the process to take and what to do. So each and every month you need to do a form that meets the requirements, sign, date, make sure it's completed similar to this. Okay, I also have a log. Let me get out of this and pull it up because it's so small. Okay, and it's still small. I've sent this out previously. I'll send it out again for you guys, but this is an example based on logs that I've received and reviewed that were excellent. So I kind of made a log for this made up company, ABC Residential Provider, for February. And I kind of wanted to go through it just a little bit to show you what I'm looking at when I'm reviewing a log and some tips that you can also do. So we have Susie Smith here. She scraped her knee. She lives at Bluebird Home. It turns out I'm looking for immediate actions here. Staff cleaned it up, gave her a Band-Aid. I'm wondering if it required any major medical treatment, if it's a significant injury. As I'm reading this, that's ruled out. There's no medical treatment needed. And it turns out her shoelaces were not tied. The prevention plan, they decided to get her a new pair of shoes without laces. Fantastic. Bob Brown at the Sparrow Home. Looks like he was taken to the ER. So I'm checking to read through this. I want to see if he was hospitalized. I hope when you're reading through, you're asking the same kind of questions. It looks like he was discharged from the ER. He has recommendations over there. So that's pretty sufficient. Danny, let's see, lives at the Robin Home, and actually he got into an altercation with Earl. So you'll note here we have, we have 2 entries, one for Danny and one for Earl. There should also be a corresponding incident report for Danny and a corresponding incident report for Earl. And part of that is because notifications need to be made to each team, and those are separate entities. The state's going to want to ask to make sure that those notifications were done. So Danny was agitated. It looks like Earl's a innocent bystander here. So what I'm doing, I want to make sure that this isn't a peer-to-peer physical act, which I'm looking at the injuries. I see bruising to the upper right arm. That's not a facial injury. As I'm reading through, there's no police involvement. There's no facial injury. There's nothing that would bump it up to an MUI level. Fantastic. I'm also curious if staff had to physically intervene and remove Danny. And as I'm reading it, it says after striking Earl, Danny ran to his bedroom and closed his door. So I don't see evidence of a UBS. That one is an excellent entry. It looks like the prevention plan, you're going to note he had a recent med change. The increased agitation will be taken to a psychiatrist. So as you're reviewing this, just check back, make sure that that appointment happened if there was one scheduled, and you can change that to the date. Went to see a psych on this date, and we talked about increased agitation. Couple more. Faith, we had a med error here in the Sparrow Home. Sounds like Faith had some visitors, and they were kind of unexpected. They stayed a little longer than was expected. So staff didn't want to interrupt that visit and missed the med pass. So it wasn't recognized until the next day. We see that all the time. The immediate action was correct for a med error. You want to call the primary care or possibly the pharmacy. If you have a nursing staff on duty, they might be able to speak to the risk and how to proceed with the next med pass, whether you need to give it late or do a double dose or whatever the doctor prescribes. That's what you want to follow. In this case, we see minimal risk. So that's not going to be an MUI, but I appreciate that they put in here that it was reported to the MUI unit and determined to be a UI. That makes it very clear. I don't have any other questions on that particular one. We'll go forward. Heather, let's see, we'll see Heather was admitted to the hospital. It's okay to include MUIs in here. And I have the MUI number. I know that I don't really have any further questions on that because it was reported. We have a whole nother case going for Heather. Jack, I see a UI rights violation here. It doesn't look like he had any adverse effect that would bump it up to an MUI level. But it sounds like he's not being able to go to church because the staff is a different faith and they feel uncomfortable. So there's a lot of ways to address that, but it is critical that you're writing these up as incident reports. You're putting them on your UI logs, even if it's just an allegation. You want to make sure you're looking into these UI rights code violations because they can worsen. They can make quality of life poor for a person. And this one has a fairly simple fix, either switching staff around or doing retraining. You know, staff, I know you're uncomfortable, but this is your work location. It's not your personal preference at this point. You're here to serve Jack when he wants to go. But in this case, I think they were able to find a different staff to take him, and that was a win-win. We'll go on down. We see Kelly Kelly's at the Sparrow House, and she also had a med error. And this is one's also very good. I want to note here in the what happened, the medications missed are noted on here. That's really good, or at least what they're for. If it's for an allergy, then that kind of your reader is going to say, okay, that's a lesser med. It's not a heart medication. It's not a seizure med. It kind of gives us an accurate picture of what was missed. Again, your primary care was notified. They gave recommendations. Again, it notes that it was reported to the MUI unit, determined to be a UI. Fantastic. Now, this one's interesting because we understand this staff was fatigued, working a lot of extra shifts. That was why this med was missed. So our prevention plan wants to address that. Maybe the program manager needs to monitor the staff schedules. We also note that this is the second med error in the Sparrow home involving this particular staff. So in this case, they took the extra measure to pull her from med passing duties until she could take that refresher on the certification. And there's a date given. Again, this is in future tense. So when you go back and check on that, you want to put it in the past tense and say, yes, this happened on 3/3. I think that's about it. Susie, one more, she had another fall. I think we remember she had a fall earlier in the month. And as we were reporting this to day program, they reported back she's been falling here as well. So that communication needs to go back and forth between all of the service providers so that you can say, well, she fell twice at home. She fell twice at day program. We definitely have a trend. Our team needs to meet. It needs to be included in the plan if it's not. And we need to discuss other options. But for a fall, again, I'm looking for a significant injury. I see she has diagnosis of an ankle strain. She was given an ACE bandage, Tylenol. I don't have an MUI. All of my questions are answered. I don't have to ask anymore. So as we're going through, again, like I gave you the tips, you want to go by person. So we saw Susie Smith had 2 in this month, and it actually turned into 4 because of the other providers' information. So it's definitely a trend we want to address in that bottom section. I noticed a couple med errors. We went by category, by home, and that was actually even narrowed down even further to staff. If we have a lot of med errors across different homes or across different staff, there might be some broader issues. Maybe it is staffing fatigue. Maybe they're working too many hours. You can look at that. Maybe they weren't trained right in the first place. You might need to look at your training tips, and you're just trying to do what you can to prevent this from happening. We don't want to see these med errors. And here in the last year or two, since COVID, I will say I have seen more wrong person, wrong med than I have ever seen in the last 15 years. Which is scary. It's absolutely terrifying because you never know what medication that person's going to receive. There's a lot of different reasons for that, but that's definitely one that's concerning enough that we want to absolutely address it, more so than the others even. But so down here, I have my name. I've reviewed it, my title, the date that I reviewed it. All of those things are what I'm looking for when I'm looking at your work, to make sure that you are reviewing it in a timely manner. You're reviewing these every month. And then again, I noted here, yes, there were multiple med errors in the Sparrow home involving one staff. And that action step was that staff was retrained on medication administration 3/3 past tense. No further incidents have been reported, and the team was notified on 3/1. And I also note, yes, Susie Smith had 2 falls at home and 2 at day program. And then to follow up on that, let's see, that Susie's team met on 3/4. They determined to have her primary care check her out to make sure there's nothing medical going on. That appointment was scheduled 3/30. So that's still in the future. So we want to hold on to that and make sure it happened. She purchased shoes without shoelaces to prevent some of those falls. And staff will encourage her to take her time when ambulating and advise her to tell staff if she feels unsteady. So all of those, again, it's just a narrative. It tells you exactly what you're doing to try to prevent this. And we're looking over time. We're looking at the next month to make sure that those steps were taken and see if they were effective. That's really the gist of what we are looking for.
We had a couple questions.
Yes, ma'am.
Could you clarify again where the MUI number comes from?
You are generating that. You're kind of making it up. Honestly, there's no rhyme or reason. We want to know that you have an organized system. My personal preference when I'm doing these for the county board is to do the month-1, so 6-1, 6-2, 6-3. But you can do any kind of system that you want to do. When I was in the provider world, it really didn't make any difference. We didn't have all that many to track. But that's entirely up to you. It's not something I'm really even looking at. I don't even think it's a rule requirement. It's just in their log.
Thank you. And then one more,
Mhm.
is the reviewed by the agency or your office person?
So you're reviewed by, it should be probably the same person doing it every month, so you can get a gist of what's going on, but it doesn't matter exactly. It's not specified that any particular person needs to do it. A lot of times if we have a program coordinator who's dedicated to MUI or an MUI contact, they're usually the ones that are looking at that. But I've seen larger agencies where they'll have their day programs doing that, doing their own and sending it in. I still want that MUI contact to do that broad overview. So as far as who, that just depends on your organization. If you're independent, you're doing it yourself. Yeah.
Thank you. We had another one come in. Great questions. Keep them coming, guys. So when you say that everyone needs to be notified, does DayHab need to notify us? And do we need to notify DayHab if something happens at the home?
Yes. For our examples, I pulled this up again. Falls is actually a requirement. So I take back what I was saying about doing a log. You do need to do an unusual incident. And I think because falls do lead to major things. But yes, if something goes on at home or day program, you need to follow the same process, write up your incident report, make sure the other provider is aware of that. Any other questions? That's about all I have. If there's no other questions, Amy, is there anything else you needed to discuss today?
I don't think so. Someone said thank you. That helps a lot. We always value your guys' time. You know how busy you are. So thanks so much for being a part of this. And Becca, thanks for your expertise in this. I really appreciate it.
I will say if there's any questions along the way, if you're struggling, if you have a particularly odd month, I'm here to help. You can send me your logs. I'll take a look, give you my thoughts. I'm happy to do that anytime.
If there was an unusual incident at day program, then as an independent provider, what do I mean, I know they notify me, but do I have any paperwork that I have to submit at the end?
No, if it happened at day program, it's
I didn't
where
think so.
it happened. Yeah. If something
Okay.
happened with you, then you would have that bulk of responsibility. You do want to keep in mind if something's going on at day program because you are part of the team. So the team needs to be communicating and addressing bottom line what this person needs at this time. But no, that would be for the day program or the other provider to have in their paperwork.
Okay, and my faux pas, that was my question about the toenail and about the wisdom tooth. So I don't have paperwork on that, and I will make paperwork on that, but then I know it's, it's been a lapse of time, but do I just send this to you guys and say, hey, I didn't realize that I needed to do that, but
So for any incident reports, if you're an independent provider, those do need to be sent over to the SSA. So if you're doing that, go ahead and send them.
okay.
It's late, but there's not really a time frame in the rule as far as incident reports.
Okay.
For
Well, I'll be
UIs.
on it next
MUIs are
time.
different, but UIs, I don't see any time frames in there. So just go ahead and let them know what's going on, and that should be
Okay,
not a
thank
big deal.
goodness there wasn't anything out of the ordinary. Everything went smooth, but I actually didn't even think about that.
There's
thank
a lot
you.
of paperwork in our field, and I know it's redundant and it feels
okay.
like a lot, but we're here to try to help you.
Yeah, I just didn't think about it when you were saying stuff. I was like, wait a minute, I probably should have done that. So,
Yeah.
okay, I
And
appreciate
it's always better for you to recognize and go ahead and take the initiative to do that, even if it's late. I think the state appreciates that better than you just missed it and forgot about it and just didn't go back to try to correct your mistakes.
Right. Okay. All right. Thank you.
Yeah, of course.
we had someone ask about the PowerPoint being available, so we recorded this. I think ideally it's going to land on our provider page on our website, but we can definitely send out a separate email to everyone that has PowerPoint, has a copy of the logs and the forms, so it'd be helpful for you guys. And
Yeah,
then
absolutely.
also, I just dropped in the chat. So Becca had mentioned earlier for that Google survey. Once you complete that, you will get that certificate, training certificate for the 1 hour. So that link is in there. I will kind of stay around for a while after this just to make sure you guys have a chance to copy that link and get that so you can complete that survey. Once that's completed, it should automatically email you that training certificate. Any other last minute questions?
I think you did want to mention the MUI analysis,
Yes.
since we're asking for those and it's coming due again.
Becca, yeah, so great timing with this. I know this is a little more UI driven, but the MUI annual analysis this year, obviously it was postponed due to DoD and their system. So I just sent that email out. You guys should all have received that just a day or so back. So just a reminder, we have to have the actual form. I know some people are emailing and just saying there's no MUIs. Unfortunately, we still have to have that form saying there were none. So I've seen that come up quite a bit. And then the other thing is just making sure you sign the date the bottom of the second page. I think a lot of folks kind of miss that because it's kind of tucked down there. So if you have questions on that, feel free to email me directly. I'm always happy to help with any questions you have on that form.
Yeah, and our analysis tips here go across the board for UIs, for incident reports, also for that MUI analysis. You want to kind of look at it with the same lens to identify more than one, and what can we do to prevent that? Yeah.
All right, that is it.
Did you say that? Oh, sorry.
Sorry.
I was just asking, the survey, is it going to come across our emails?
So it's in the chat right now. If you're able to pull the chat up and copy that link or click on it directly from the chat. Does everyone see that in there?
I see it. Thank you.
Yeah, sure. No problem. Thanks for asking. And again, I'll probably kind of hang on for a little longer just to make sure you guys have a copy to get a chance to copy that link too. There is nothing else. Again, I just want to thank you guys for your time, and Becca, thanks again for all the helpful information.
Thank you, guys.
All right, thanks everyone. Enjoy the rest of your day.
Thank you.